In this clip, we'll talk about the procedure itself and then a little bit about the aftercare. In the procedure, a patient will be in the operating room, and just prior to the operating room, some markings will be made on the chest after the full discussion on the specific size and the location of the implants and the incision, that the surgeon will then mark on the chest wall with a marker where the incision will be made and where the implant will be placed. Those markings allow proper placement and decision-making in the operating room. Then the patient will be brought into the operating room and placed gently to sleep, and the surgery will be performed after preparing the area for sterility with an antibiotic soap, and the surgeon and his assistants and team will be in sterile gown and gloves and performing the operation. After the operation, the patient is brought to a recovery area, and they will have received some pain medicine in the operating room, and there's some local anesthetic, so there's not that much discomfort initially. Later, when the patient goes home, they will have some medications by mouth to take to decrease pain, and really only for the first day or two there's some moderate discomfort, and most people are back at work within 3 to 5 days, and then full activity within 2 to 3 weeks.